So without further delay, we'll shift gears from type 1 to type 2 diabetes. We have with us Dr. Khadija Hafidh. Dr. Khadija is a consultant physician and diabetologist. She has more than 20 years experience in clinical medicine and in medical education, and she's a fellow of the Royal College of Physicians of Edinburgh. She's currently the head of the diabetes unit at Rashid Hospital, Dubai Academic Health Corporation. Dr. Khadija, we're looking forward to hear from you.
Assalamu alaikum, dear colleagues, and good afternoon, everybody, friends. First, I'd like to take this opportunity to thank the organizers for the kind invitation. It is sheer serendipity. 2 weeks ago, I was at a conference with Dr. Mohammed, where is he? And he asked me, are you attending the conference, the obesity conference in Abu Dhabi? And I said, yes, I am, but I was coming as an attendee. And all of a sudden, I have this invitation to come and speak. So Nasreen is not here, but definitely networking is really important in anybody's career. So thank you very much for this invitation. And I was given the task, the difficult task, to speak after Iba and talk about obesity and type 2 diabetes. Now, you've already heard a lot about that since yesterday. And in fact, when I was listening to Dr. Taheri's lecture this morning, I was having palpitations because I thought, right, he said everything about obesity and type 2 diabetes. What am I going to say? And then, fortunately, Barbara came on, and she put back the confidence in my, in my tone, and I thought, okay, maybe there is still hope, and I can say something about that. So before I do that, that's my conflicts of interest. And so what I am going to do is address this issue that we sometimes refer to as diabesity. I will highlight the epidemiological link that we have between obesity and type 2 diabetes, review the need for early diagnosis and treatment, and discuss some of the benefits of implementing these interventions early. Now, this audience is very well aware of the burden that we have of diabetes globally and here in the region. We have about an 87% increase of obesity projected for 2045 if we're not going to do something about it. And then when you look at the global burden of obesity as well, currently we have over 1 billion people affected, amongst which, of course, are also adolescents and children. And what I've circled over there is, you know, and you've heard the numbers in the morning from Dr. Fathia presented, that we have the highest number of individuals with BMIs that are greater than 40 in our region. So the dark area there is us, and that sort of mirrors the diabetes epidemic. So we think that probably the obesity epidemic is what's fueling the diabetes epidemic as well. So we all know, and we've all heard quite extensively yesterday and today, that obesity is driven by many contributing factors. Not all our patients with obesity have type 2 diabetes, and not all patients with type 2 diabetes have obesity. And you're all aware of all these, so I'm not going to dwell so much on that. But what I do like is the fact that we've now moved on from just the BMI, as we've heard from Rachel yesterday, and we're really compensation. And on the other hand, diabetes can also lead to obesity because of the medications. And yes, the patients did put on a lot of weight. You heard already about the complications of obesity happening in type 1 diabetes, a lot of it related to hypoglycemia and snacking and so on. Stigma and impaired mental health as well, from diabetes can
comment and not question. Whenever we are now prescribing the GLP-1 for type 2 diabetes, you have to enter a battle with the insurance company, because for the same patient, no matter how much you provide, report for your patient that hemoglobin A1C has dropped from 11 and you maintain it in 5.5. Whenever the patient becomes controlled, the insurance company are not covering the medicine. So I don't know if there is anything will be done at the level of Ministry of Health. For the same patient, every 3 months, I have to resend again report to verify my prescription.
That's an absolutely correct comment. It is a conundrum that we're all facing. And I think in the obesity world, we're going to have to do more advocacy and make sure that we educate the payers that this is a disease, if managed early and tackled early, we're going to reap the benefits in the long term. I think this is the message that we need to send across. And yeah, I absolutely agree with you. It is a real conundrum. Yeah.
Thank you.
Thank you. Thank you so much.